Hello, wonderful people. Welcome to my channel. Today's discussion will be the continuation of peptic ulcer. So if you've not watched that of part 1, you know how to do, right? You pause the video here and you start from there. Let's continue our discussion. Talking about peptic ulcer, people think they are far away from peptic ulcer, and that's not true. Anybody is very near to peptic ulcer. Looking at the rates of transmission, for instance, individually we normally give ourselves first aid in terms of any pain like headache, stomachache. We don't normally visit hospital for perfect or vivid investigations and good taking of history. So we just visit a nearby counter and we talk to them, and they, at the end of the day, the only drugs they may offer is those painkillers, those non-steroidal anti-inflammatory drugs. And at the end of the day, if you take them continuously, as I said this in the first video, you are going to increase your chances of having hot peptic ulcer. So take notes and don't be taking them much. And talking about aged, those old age, they normally experience arthritis, those osteoarthritis, rheumatoid arthritis, and all the arthritis. And for that matter, they normally take in those painkillers in order to relieve from what they are experiencing, that pain. And at the end of the day, it will also increase their chances of having peptic ulcer. And we can talk about personal hygiene. You know, personal hygiene is of no respecter of person. It doesn't matter you are an adult, it doesn't matter you are a child or you are a teenager. If only you do not practice it, it will be easy for you to come in contact with those bacteria, H. pylori, and at the end they too will cause harm and there will be peptic ulcer. So take notes and never think you are far away from such. Yes. And in terms when you visit hospitals, so and the doctor wants to take good history in order not to increase your risk, they can ask you, have you had ulcer before? It's not that they are going to take any money from you or they are going to write expensive medication for you. All what they want to help you is not to give you drugs which will not help you or will aggravate what you've already healed from or what you are still experiencing. That's the reason why they may ask you, or even if they do not ask and you know you are an ulcer patient, you can even tell them that, doctor, I am an ulcer patient, and they will know what to do about your situation. So take notes. How would one know that he or she is having peptic ulcer? Yeah, because the ulcer we are talking about right now is not external ulcer but internal ulcer. And for that matter, how do you know that there is ulcer within you? Under normal circumstances, man must eat and get satisfied. But here is the case, only you, the moment you are hungry and you take in food, you start experiencing pain. It's either the pain will be in the process of eating or after eating, let's say 10 to 15 minutes, you will start experiencing pain, which is not normal. This shows that there is a gastric ulcer. Because there is ulcer, the moment you took in food, it will switch the acid on to help in digestion, and that acid will get exposed to those ulcers. It will come in contact and you'll start feeling pain. That's the reason why. And if you have the duodenal ulcer too, you'll be feeling pain whilst you are hungry. And you know, under normal circumstances too, if a man is hungry, you have to experience or sense hunger, but not hunger pain. But here is a case, you will be experiencing hunger pain, and the moment you take in food, your heart gets relief from the pain. So all these changes will just give you an idea that there is something going on which is not normal, and you have to see a doctor. And because when you take in food, you'll be feeling pain in terms of that gastric ulcer, you don't like to take in food, like you don't prefer taking in food in order to have that pain or experience pain, and you'll be losing weight. So you know that this is not how I am, but now I'm losing weight. That shows that you are having that gastric ulcer. But for that of duodenal ulcer, because food intake relieve you from that pain, you even wish to always be taking in food, eating all day all the time, and in order not to experience hunger pain. And if you continuously do that, so that means you are going to gain weight. So you will be gaining weight in terms of that duodenal ulcer. So take note of that and go and see a doctor immediately you see such changes. And there can be also dyspeptic signs, or you will be feeling discomfortness. Yes, for instance, when you take in food, or you will be experiencing some nausea, like you feel like vomiting, or you can even vomit, or like that discomfortness, which is not normal. You will be experiencing all this. You feel bloating or beiging. All that shows that there is something going on which is not normal. So you have to rush to see the doctor. In case you fail to seek for medical attention, that means you will be complicating your case, because even external sore, if you fail to treat it, there can be penetration. It will never heal. The same applies to that internal sore, or gastric or stomach or duodenal ulcer. If you do not treat it, there can also be penetration, and it will penetrate to the extent that there can be perforation or puncture. You know that organs are like tube containing contents, and if there is puncture or perforation, that means the contents will splash into your whole abdomen. Yes, it can be peritonitis, and it can cause infections to the whole organs or neighboring organs. So don't stay home and wait and think that it's just a mere pain, because there can be complications, and even there can also be bleeding. You can even bleed to shock or to death. So don't waste time. And if even that gastric ulcer, if it is ulcer, it can be cancer. It can be cancerous if you do not treat it. Yes, it can be cancer. So don't stay home and think it's just a mere case. And the duodenal too, you can bleed to the extent that it will contain whole blood, which will prevent even the pain you are experiencing, which serve as a yardstick or create awareness for you to know that there is something wrong going on. So I have to seek for medical attention. If the pain stops, that means you think everything is well or all is well, but meanwhile it has just created a conducive environment, alkaline environment, which has prevented pain, but still there is something wrong going on, and it can be a very big complication. So don't waste time. And there can also be even obstruction in terms of the outlets. There can be obstruction, and if there is obstruction, that means you'll be experiencing a whole lot of discomfortness. Yes, so don't waste time. How can one prevent peptic ulcer? In order to prevent peptic ulcer, there are some lifestyles which can be modified. For instance, if you are alcoholic, you have to put a stop to it or reduce alcohol intake. And if you smoke, you have to quit from smoking. And intake of those spicy food, so those citrus fruits and caffeine, you have to reduce intake of all, and know how to manage stress. You also have to practice personal hygiene in order to prevent your chances of having peptic ulcer. And there are some lifestyles which are also not modified, like there are some factors you can't modify. For instance, genetically, if you are type O blood group or A blood group, as I said, from research, your chances of having ulcer is high, and you can modify. And if you know you can modify such, that means you have to focus much on those you can modify in order to practice it, because your chances are already high. So don't involve yourself in those lifestyle which will increase your chances. Yes. And age, if it's true age that you are having such ulcers, that one too is not easy, or you can't even modify it. So focus on lifestyles which you can modify and practice that one very well. Thanks for watching. Like, share, comments, and subscribe.